Hey guys, this is Dr. David Midoff of El Paso Manual Physical Therapy. Some of our patients ask us if an inversion table is right for them. Usually they're dealing with back pain or neck pain, and the thought is that it would help their disc. And for those of you that have never been on an inversion table, it looks something like this. This is an inversion table we have here in the clinic. It hangs you backwards. You put your feet in that contraption down there and then lean back. And this is what it feels like to go back in an inversion table. Hopefully you can kind of follow along.
And I'm so tall, my head hits the ground. Here's a view in the mirror. And from my viewpoint right here, my feet are hooked up in the contraption. All right, so I made a rookie mistake. I've adjusted the table for my height now, and hopefully you can tell I'm upside down. And if you've got a true spinal disc problem, it can certainly help to unload your back. It'll help your disc to heal. But here's the downside, no pun intended. I'm not gonna last very long here. You could probably see the veins bulging in my head, and all my sinuses are all filled up now. It might be hard for you to get on one of these on a consistent basis, so it may not be a good long-term treatment to keep doing. There's certainly better ways to unload your discs. That's what we help patients do all the time. But this could be a great solution if you want to avoid taking pain medications. This could be a natural option for you. Inversion tables like this one are relatively cheap. You can usually find one for $100 or $200. And they tend to last a really long time. They're usually pretty well built. You can use them again and again. But hanging out here for more than a few minutes is really hard. The blood rushes to your head. Your eyes feel like they're gonna pop out of your skull. And it feels like my ankles are about to be yanked off my legs because I've been here for so long. Let's see if I can get out of here now. Let's try this again.
Woo! That was exciting. All right, so in my opinion, there's way easier ways to help treat your back problem, especially if you have a disc problem. There's some very natural solutions that we can offer. And let me just show you one of our most common ways that we help patients to treat their lumbar, their low back problem. This is especially helpful if you sit all day. If you're the type of person, you have a job where you have to sit for long periods of time, chances are you need this. If you think about your lower abs, like this is my belly button below your belly button, getting those to fire and suck in tends to unload your discs. Now the trick is you got to fire those low abs all day long, especially when you're in those postures or positions where you get pain. So we literally tell our clients you need to have your abs turned on 8 hours a day or 10 hours a day or however long it is that you need them. It's not enough to just go do sit-ups, 100 sit-ups or an ab workout of some sort, because that's only firing your abs for that period of time. And it's not enough to be in an inversion table for a few minutes at a time, because it's only helping your discs at that time. A much better long-term solution is firing your abs on a low level all day long, because you can get all day long treatment. And also consider that if you've been told you have a disc problem in your spine, you've probably had it checked out through an MRI. That might not be the cause of your pain. You might have a facet joint, one of the other joints in the spine that's stuck. You might have a muscular problem or a nerve problem as well. So using an inversion table may not be the best thing for you. You need to make sure you get right guidance on how to use it and when to use it. We pride ourselves in being experts at treating back pain. If y'all ever have any questions regarding it, please contact us. We'd love to help you out. Thanks for tuning in. This is Dr. David Midoff with El Paso Manual Physical Therapy. Have a wonderful day.